Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer in Douglas County. This is another of our COVID conversations today for January 27th, 2022. We've been doing this now for 2 years. Just almost exactly 2 years ago, I was on the radio talking about this new germ that was out there called coronavirus and what we should do about it. And at that time, we said we didn't really know, but we'd need to see the way it played out. At that time, we were concerned because there were a lot of cases in China and there was a fear that it could spread around the world. Well, it has. It's spread around the world, and we're now in another surge. We started off with the first surge, then the Alpha surge, then the Delta surge, and now we're in the Omicron surge. And in the world, the Omicron surge is really the biggest one ever. So there are more cases now in the world than there have ever been of COVID. This one seemed to start in Omicron in South Africa. They've already peaked and are starting to come down. Then it went to England. They've peaked and have started to come down. In Denmark, they've peaked and started to come down. And then spread to the US, mostly on East Coast cities like New York and Washington, D.C., and they've peaked and come down. We were a little later here in Oregon, and we'll get to that. But in the world, we're seeing a lot of disease in Europe and really staggering case counts. So Israel had a case count yesterday over 1,100 cases per 100,000 people. So in the past surges, the highest anybody ever got was 400 or 500, 1,100 cases per 100,000. And this is in Israel, in an area where there's a lot of people who are vaccinated. The good news is very few deaths. And also in the UK and in Denmark, where they had a lot of disease, a moderate number of hospitalizations, and only a small rise in their death count. But in the world, we're seeing a lot of disease in South America now. We're seeing an increasing amount of disease in Africa. We're seeing a rapidly increasing number of cases in the Philippines, and we're also seeing more cases in Japan and India. We're also a little worried because the Olympics are starting in the next few weeks, and that's going to bring a lot of people to China, and there's a concern that we might see an increase in cases in China. And the reason we worry about cases in other parts of the world are several. One is it draws away PPE that we would be using in this country. And by having that much more disease, it makes it more likely that another variant is going to develop. So variants can develop at any time, but they're most likely to develop in an area where there's a lot of spreading disease. So the world picture is a little bit worrisome. In the US, I think we've peaked. I think in the US as overall, we're starting to come down, especially in the big cities in the East. And they've seen a relatively rapid rise in the number of cases, and now seeing a relatively rapid fall in the number of cases. Still a lot of people in the hospital and still a lot of deaths, but not quite the catastrophe that we worried about. In other parts of the country, it's a little later to hit, and in Douglas County, I think we're one of those areas. Oregon still has a high number of cases. I cannot tell yet if Oregon peaked. But some of the counties that started off with a lot of cases, like Deschutes County and Multnomah County, look like they're starting to come down. Douglas County, again, started a little bit later. We've had a lot of cases in the last week. We've had over 1,000 cases in the last week. And in the whole pandemic, there are only 7 days where we had more than 200 cases. And 2 of those are in the last week. So we're seeing a lot of cases. And we think there are a lot more cases out there than we are currently finding. Back in Delta, there weren't very many home tests. And back in Delta, it was serious enough that we recommend that everybody get tested. Now we're seeing 3 reasons that I think that although we're still reporting 200 cases, there are probably plenty more out there. The first is that many people with this seem to be mildly ill. So in clinic this week, there were a number of people came in, thought they just had a little sore throat or a little bronchitis or a little sinusitis, and said, "Oh, it couldn't be COVID because I'm not that sick." Well, when we tested, it turned out they had COVID. So at least with Omicron, especially in people who are vaccinated, they're getting very mild illness that they may not even go and get tested for. The second reason is we're telling people, look, if you're mildly ill at a time when there's so much COVID around, you probably have it. You don't even need to go out and get tested. And please don't go out if you think you have it. Please stay at home, because getting a positive test or negative test is really not going to change very much. And the third reason is there are a lot of home tests out there. And with home tests out there, people don't always report those results. So although we're reporting 200 cases a day yesterday, it probably was far higher than that. And we assume that because when we look at places that do a lot of testing, for example, the hospital and health clinics, the amount is far higher. And schools, which obviously monitor absenteeism, have seen absentee rates as high as 50%. So we know there's a lot of disease around. And that's not necessarily a bad thing, because as people get Omicron, especially if they get mild disease, they will build immunity. And the more and more people have immunity, either from vaccination or from prior infection, the less likely it's going to be able to spread the next time it comes around. Now, one of the things we've seen again and again is that vaccinations really do work, and vaccinations plus booster really, really work. So, for example, this week we've had the low 30s in the hospital. Of those, most are not vaccinated. And remember that over the majority of the population is vaccinated. So for the majority of people in the hospital to be unvaccinated suggests that vaccines do help. We think you have 5 to 8-fold protection by getting your primary series. But then when we look at the booster, we've had very few people in the hospital who have been boosted, and very few of our deaths among those people who've been both vaccinated and boosted. So again, the vaccines work. A vaccine plus a booster works even better. So we're really encouraging people, if you need to get your booster, please go get it. Our testing site is available here in Roseburg at the Fowler Street lot every day from 10 until 5. And they're doing boosters of all the vaccines. They're doing all the primary vaccines too, and they're doing testing. And they're available in that lot every day from 10 until 5. We are recommending that if you're mildly ill and don't need medical attention, just stay home. If you have a home test, that would be a great one to use. And we think home tests are going to become more available in the next few weeks. The feds have a site through the Postal Service where you can order these tests. And several of the people I know have ordered these tests early on last Tuesday, so really only 8 days ago. And they now have already gotten the tests. So if you want to do that, you can look at our press release from yesterday, and it'll show you how to do that. In addition, the state bought 6 million kits, and we're going to get 15,000 of those in Douglas County. We're going to be distributing them through fire departments around the county. The fire departments are close to people's homes. They know where they're at, and they can go ahead and get them there. We're also going to be distributing through Wheels on Meals and in Reedsport. So there's going to be much more testing available in the future. And the best ways to use those tests is if you have symptoms. Don't require medical treatment, so you don't need to go to the doctor. You can test at home. Usually on those cases, we recommend you wait till the second day of symptoms to test. First day, the tests don't always show positive, but by the second day, they almost always do. So that if you're having symptoms, wait till the next day and get tested. Second good use for the test would be if you were exposed to somebody who had disease. 5 days after that exposure, it would be good to get tested. If you're negative 5 days after exposure, you're probably going to stay negative, and that's a good thing. And then the third reason you might want to use these tests is before an event. So for example, if you're going to visit your mom in the nursing home, you really would like to know to be sure that you're not infected when you go to see her. And the tests are not perfect, but pretty good. If the test is negative in that situation, you probably don't have it. If it's positive, you almost certainly do have it, and you should stay away. So those would be the 3 reasons for the tests. We're also starting to see the tests be more available in markets and pharmacies around the state. So it's always good to have a few of those home tests around. So you can get 4 tests through the feds, you can get tests through the local fire departments, and we'll put the details out when they finally arrive, or you can get them at the store. A couple of other new things that have come out. When we look at the variants, it's almost all this Omicron variant, although there's a new subvariant of Omicron. So Omicron is BA1, this other variant is BA2, and it's a lot like Omicron. It's got some other new things, and it's being seen especially in Norway and Denmark, where it's spreading quickly, but it doesn't appear to be that much different from Omicron, and it appears that you get one or the other, but not both. So we may well have good protection, but that's something, again, we're going to be following very, very carefully to see. Other things that have been happening is we worry about our hospitals. The hospitals are struggling. This is a time of year in January where they struggle anyway, with lots of other illness going around, some difficulty staffing. And now our hospitals are definitely seeing that. In Oregon, we have almost the number of hospitalizations now with Omicron as we had with Delta back in the summertime. But in the summertime, There's not a lot of other disease going around. In the summertime, the hospitals had less staffing issues, and now they've got staffing issues. A lot of workers who are ill, not seriously ill enough that they're in the hospital or anything, but serious enough that they can't work. And so the hospitals are down in staffing, up in patients, and so they're struggling a bit to manage that. I think our hospital here, having gone through it in the summertime, is pretty well prepared to go ahead and get that done. There's other new news out there. The antiviral drugs Paxlovid and Molnupiravir are here in Douglas County. We don't have a lot of doses, but for people at high risk, those people who are over 80 or those people who are over 70 with underlying conditions, you can talk to your doctor about getting one of those medications. The monoclonal antibodies, which work so well during the Delta time, so the Regeneron and the Eli Lilly, they're still around, but they don't work. So there's really not much sense in getting either the Regeneron or the Eli Lilly product at this point. There's one of those monoclonal antibodies that might still work, called sotrovimab, but again, we have just a few doses of that at the hospital, and the hospital is limiting that to people who are at the highest risk of disease. So where are we going here? So I think when we look at these other places in the world that have had these big, tall peaks, they've gone up very quickly, but then they've come down very quickly, and that's a good thing. Typically, it takes places about 3 to 5 weeks to go from the first time they start having an increase in cases till the peak, and then another 3 to 5 weeks to come down. So if I'm doing my best predictions, and all of these predictions are predicated on not coming up with a new variant, because if you'd asked me November 15th what I was expecting, I would say I would expect to see a low number of cases over the next few months. But then Omicron comes out, and with Omicron, it totally changed the world. So that if there's not a new bad variant, and there certainly could be, but if there's not a new bad variant, what I would expect is that our cases are going to peak in the next week or two. So sometime in the last week of January, or the first week of February, and then start to go down in February, so that by March, the number of cases would be lower, and that by spring break, the cases would be very low. Again, this is all predicated on not having another nasty variant, but with the amount of disease we see now. And that would truly be great. It's been 2 years we've been working on this, 2 years since I've had a full day off, and it certainly would be good to get to a point where we could get to this part of the pandemic where we could talk about other things, rather than being so worried about COVID. But right now, in the next 2 weeks, it was still going to be a bit touch and go, with a large number of cases, a fair number of people in the hospital, and just a lot of people sick in the community. So our advice is just the same. It really hasn't changed at all. Our advice from the very beginning is take good care of yourself. If you can get a vaccine, please go ahead and get a vaccine. If you're due for a booster, please get a booster, because these really work. Avoid crowded situations. There's a lot of disease right now, and I think being in a big crowded room really puts you at risk for getting it. If you are going to be in a crowded indoor situation, to wear a mask, and do the other things you can do to stay healthy. Get enough sleep, get some exercise, and enjoy those things in life that you enjoy. So again, we've talked about public health being kind of like the weatherman and predicting the weather. And what I would say is right now, the weather looks stormy over the next 2 weeks, but then improving, and we're predicting a very pleasant springtime. So stay well. Again, if you need a booster, please, please, please go ahead and get one. Again, there's a vaccine site at the Fowler Street lot across from the Roseburg Public Library every day from 10 until 5. And they have all of those vaccines, no charge, no insurance, rigmarole, just go get it. And then, as we've said from the very beginning, be safe and be kind. Now, one of the special pleas I'll be making is for our blood supply. So blood supply in the U.S. is really important for people who have cancers, for people who are getting chemotherapy, for people who have blood disease, or people who have trauma. You really need blood. There really is no substitute for blood and blood products for those people who need them. And so over the years, I've cared for dozens of kids who have cancer, and they would not have made it through their chemotherapy if they'd not been able to get blood transfusions or platelet transfusions. I cared for hundreds of preemies, many of whom needed transfusions along the way because their body wasn't able to do it. And unfortunately, I know a bunch of kids who've been in terrible wrecks, and their lives were saved by blood. So most of those things, accidents and cancer, haven't gone away during this pandemic. So cancer is still there, accidents are still there, and so we still need blood. But because many of the donors are people, adults, who have been sick now because of COVID, our blood supply is at an all-time critical low. And so if you're able to donate blood, please go ahead and do it. I donated my 100th unit last month, so go for it. Doesn't hurt that much, and it's really an incredible thing you can do for society. There's a blood drive tomorrow at the Backside Brewery, so go ahead and do that, or talk to the people of the Red Cross and sign up. So when people sometimes feel a little helpless, they're like, well, what can I do? The one thing you could do right now would be to go ahead and sign up to be a blood donor, because I think that will be a great addition to the thing. And for those people who need it because of accidents or because of cancer or because of prematurity, it's going to be a tremendous advantage to them. So please, if you have the opportunity, go and give blood. Again, this is Dr. Bob Dannenhoffer, forecasting pretty stormy weather over the next 2 weeks, but then improvement thereafter. If you have questions, please send them to us at Facebook questions at DouglasPublicHealthNetwork.org, and we'll get to them the next time we do this next Thursday. Take care.